I'm sure that you have a lot of things to say
Yes.
on the issue. Wouldn't you like to present your personal view on the question that you did?
No,
You're perhaps one of the best persons in this.
Okay.
I believe when the academy was created, the French Academy, the Royal Society, in the 1860, the National Academy of Science was created by a decree of Lincoln. And the idea was that to create the academy to give science-based advice for the nation. So the academy belongs to the nation. You know? And this is the role of the academy, to provide sound, science-based advice. To do that, they need to be recognized. This is, I believe, is one of the major problems in our countries. If the academy be strong enough to be seen as a provider of advice. In the case of the medicine, to be recognized by the Minister of Health, the Congress, any level of decision to be recognized of a place where the society can ask questions and see what we know and what we don't know in some areas to do policy. As you said, it's necessary to have good data to decide politically. So this is the. But I believe in our countries, not only you need to try to provide information of all the knowledge that we have, but also to see if the country is doing research, because it is local problems that we need. So the academy also needs to identify problems in the country that are necessary to put more effort in the research. So the organization of the science, technology, innovation in a country is part of the political agenda of the academy. The academy must be involved in discussion, science, technology, innovation in the country. And this is what happened in this country, Brazil, in the last decade. We are recognized by the federal government, state government, anybody that can be helpful to discuss what is necessary for improving the system of science, technology, innovation. So this, I believe, is some idea that I am brought in that to see that after this meeting here, we can exchange experience of the role of the academy in each one of our countries. So maybe we can increase our effective way to work in each country. Okay.
Yeah, and when I
Of course, the basis of all these is also education. You cannot talk in science, technology, innovation without talking in education. And so one thing that we need to discuss and how we can, and this we have discussed in the executive committee, how we can put some effort of the Academy of Medicine in science education, because the Academy of Science are doing this quite well in the world in the last decade. So we need to put health in the system of science education, because health is fundamental in any science education. So I believe one of the idea that we need to work out is how the academies can be involved in science education, in health, in each country.
Yes, I fully agree. When I mentioned the asymmetry in the continent related to the ministries of health, that also applies to the academies. So we have very active academies on the continent, like the Brazilian, like the Mexican, like the National Academy of Sciences in the United States, from Chile, as well. And but the Cuban, I'm forgetting, but some of the very active academies. But we have a number of countries without academies, for example. And so we have to consider the level of development in different areas and the levels of organization of the health professionals.
But if we have a network of academies, we can help big countries that have no academy, or those countries that the academy is not working by several reasons, so we can exchange experience. This is the way I believe we need to work in the area here in America.
This is
have a network.
This is going to be the issue for the last session of the meeting. Yeah, precisely how we can collaborate between countries in order to build capacities in the countries that require.
Thank you, Pedro. What I can tell you is, what I can tell you is the example of the Mexican Academy of Medicine. The Mexican Academy of Medicine, the National Academy of Medicine, is over 150 years old. But it began its paper as a bridge between knowledge and politics about 70 years ago. 70 years ago, there was the foundation of the two National Institutes of Health. That was the National Pediatric Hospital and also the National Institute of Cardiology. After that, there has been several National Institutes of Health. We have right now 13. And the Academy, the National Academy of Medicine, has served as a bridge between the development of knowledge between the National Institutes of Health and the health authorities, because 50 years ago, the National Academy was named advisor for the federal government in Mexico. So it has a paper with the health authorities. We make this knowledge to reach the authorities, and they promote laws with the Congress. There is a broken bridge between the government and the Congress, unfortunately. As usually happens in, let's say, every country, whatever that means. Because our recommendations, very random, reach to a law. But the National Academy of Medicine in Mexico has served as this bridge, and we keep on this into this paper. Let's say that these agreements and these laws that have been passed in Mexico have the foundation in the activities of the National Academy of Medicine. And that is why we think we are in the right way in order to promote this relationship, in order to promote this knowledge that we may have from the surveys and also from clinical data and all these studies may reach the authorities in order to become laws and also regulations that may increase the public health in Mexico.
Any other question? I think that Professor Krieger mentioned a very important issue related to the operation of the National Academies of Medicine in the continent, and their ability for regional cooperation. This is happening very well for the science academies in the country. And perhaps something that we need to think about is how come we can foster the level of collaboration between the national academies of medicine. And I agree that health education is a major issue.